Okay, we are right at the top of the hour, so we're going to go on and get started today. I would like to welcome everyone and thank you for taking time out of your busy day to join us. We are very excited to start this three-part series on risk management and carrying out your risk analysis. So today we'll be covering planning your risk analysis. And just a few housekeeping items before we get started today. All attendees will remain muted throughout the presentation, but I would like to welcome and encourage you to ask any questions you have using the Q&A feature, which is located on the WebEx toolbar. We will be reserving some time for those at the end. Additionally, all attendees will be receiving a copy of the slides and recording following today's session. So now just for a little background about who we are, Kirkpatrick Price is a PCI QSA and licensed CPA firm providing assurance services to clients worldwide. The firm has over 11 years of experience in information assurance by performing assessments, audits, and tests that strengthen information security and compliance controls. We offer both regulatory compliance and information security services. Our regulatory compliance services consist of policy and procedure review and development, risk assessment, internal audit plan development, as well as readiness audits. We also provide information security services and guidance and audit for PCI DSS, SOC 1, SOC 2, FISMA, HIPAA, and ISO 27001. I would also like to take a quick minute to invite you to connect with us. We are constantly sharing and creating new educational content to help provide the industry with updates, tips, and best practices. So please subscribe to our blog, connect with us on LinkedIn, and follow us on Twitter to keep in touch. Now to introduce our speaker for today. Mark Heinley is a regulatory compliance specialist with Kirkpatrick Price and a member of the Florida Bar with 9 years of experience in healthcare law, regulatory affairs, and internal compliance in the public and private sectors. His specific experiences include serving in the General Counsel's Office for the State Healthcare Oversight Agency, regulatory affairs for Medicare, Medicaid, HMO, and complex healthcare litigation. He is also SAM certified in the law of data security and investigations. So welcome, Mark.
Thank you, Sarah. I appreciate that. And welcome. I want to extend my welcome to all of you for joining us in the first part of our series on HIPAA risk analysis. And I just want to state at the beginning that if you are joining us for an understanding of risk analysis beyond just HIPAA purposes, that a lot of the core principles and activities will apply to risk analysis beyond HIPAA requirements, but there will be a lot and primarily a focus on applying the requirements under the security rule. So that's why are we talking about a risk analysis on 3 separate webinars beyond just the desire for us to extend our educational content over a 3-month period. The first reason is the regulatory reason. That is, it's required under the security rule. And specifically, the requirement is to conduct a thorough and accurate assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by the entity. But a more tailored focus than a risk analysis includes considerations of reputation and prospective business impacts. The second reason we want to spend so much time on this issue is because we are aware, based on our own experience in providing these kinds of services and then our engagements with the OCR as part of the Phase 2 HIPAA audits, is that we know that so many entities struggle with this requirement. It was a struggle that was identified in Phase 1 of the HIPAA audits, and our experience in the years since that first phase of the HIPAA audits indicates that organizations are still struggling to understand what the requirement is and then to execute that requirement. So we know it's a requirement. We understand that the industry is struggling with it. And then we also know that completing a risk analysis provides benefits beyond just compliance with a single security rule requirement. You know, if you look back at the comments that the department issued in response to the security rule risk analysis requirement, when they got feedback from the industry, they said, risk analysis and risk management form the foundation upon which an entity's necessary security activities are built. So from the department's perspective, this isn't just a single requirement that you must complete in order to check one box off the list of things to do under the security rule. This is the start of a compliance path. And I think you'll see that as we look at some of the case studies that we've included in this presentation. You'll see the connection between breaches and a lack of compliance and the lack of a complete and thorough risk analysis. So the case studies will kind of provide us with a backwards look at what happens when risk analysis aren't performed at all or aren't performed in the way that they should be. So I want to offer a suggestion or a recommendation as we begin this, not just this presentation itself, but our entire webinar series, is that if you've never completed a risk analysis or you're trying to do one right now, that you could use this risk analysis series to help you walk through your entire risk analysis or even just a portion of it to get an understanding of what the OCR is looking for. So for example, today, take notes on all that we talk about with respect to the goals of a risk analysis, resources, scope, and information gathering. And then you'll have several weeks between this presentation and our next presentation where we're going to actually talk about the nitty-gritty of identifying threats and vulnerabilities, talking about potential impact, talking about the likelihood of a threat or vulnerability occurring, and the controls that are potentially in place to reduce the residual risk. So you'll have several weeks between this presentation and the next presentation, and then you'll have several weeks to go through and maybe identify some threats for your own organization and vulnerabilities and complete a portion or all of your risk analysis. And then if you attend our final session several weeks later, you'll learn what to do when you've completed your risk analysis, the kind of internal senior management reporting and kind of corrective action plan and testing that should occur when you finally completed the risk analysis, because the work isn't done just when you've completed the identification of the threats and the vulnerabilities and you've got a risk matrix. The work isn't done there. There's still a few steps to take, and we're going to talk about that in our final presentation in this series. So that's my recommendation to you, is to take this this webinar series as not only just information, but as a three-part series that will walk you through conducting a portion of your risk analysis. So let's talk about today's topic. As we've identified, today's topic is planning for your risk analysis, and we think it's important enough to spend an entire presentation on planning your risk analysis. And there are 5 different portions of our planning presentation: goals, resources, scope, information gathering, and perspectives. We'll spend the bulk of our time in the scope and information gathering sections of this presentation. But I just want you to have a roadmap for where we're going for today. So let's talk about some of the specific ideas in planning your risk analysis, and let's start with goals. And the reason that this is so important to plan is because incomplete planning on a risk analysis will result in incomplete results. And as we're going to see in one specific case study, that doesn't comply with what the OCR is looking for, and it doesn't set our organizations up for success. So the first thing we need to do in planning is to understand what the goal of a risk analysis is. A risk analysis is not the same as an overall HIPAA gap analysis. There are a bunch of different words that the industry uses because there isn't a regulatory single definition for the kinds of audits for compliance that a gap analysis would be looking for. So it's important to distinguish what we're looking for when we talk about a risk analysis. A risk analysis asks, how much exposure do we have to unauthorized access or disclosure? And then what else do we need to do beyond what we're currently doing to reduce the risk that we've identified at the end of the day? So risk analysis is looking for exposure, and then it's looking for follow-up actions. A gap analysis is asking, how are we doing compared to what the regulations require us to do? So if you're talking about the privacy rule, for example, and right to access, do we include the right content in our notice of privacy practices? And are we responding in a timely fashion to access requests? And does our template form for access requests comply with the requirements? And so you're looking for the requirements and what you're doing, and seeing whether or not you think you're compliant. A risk analysis is much more, provides greater layers of information. It says how much exposure you have, the likelihood that something bad could go wrong, and then it's going to identify the controls that you have in place to reduce that potential risk. So there are going to be items that are uncovered during a risk analysis when you say, here is a potential bad thing that could occur. It's really, really likely to occur, but we have these controls in place, and we think they're sufficient to address the risk of what could happen. And then there's going to be items where you identify potential threat and vulnerability and determine that you have no or little controls in place, and the risk, the residual risk, the final product is a very, very high likelihood that this bad thing could occur, and ePHI could be inappropriately accessed or disclosed. And that's a different kind of consideration than just whether or not you have something in place. So understanding our goals is important. We are looking for exposure, how much exposure we have, and what else we need to do to reduce, if anything, to reduce that exposure. The second thing we need to do in our planning stage of the risk analysis is to talk about our resources. So once we know the end result, this list of threats and vulnerabilities, we need to know who's going to lead the project, and then ask the question, do they have the proper experience in conducting risk analyses? Do they have leadership support? So just because someone may have lots of experience in conducting a risk analysis, if they don't have leadership support, they may never finish the product or project, or it may be finished but not responded to properly. And then have the individuals involved in leading this project, have they reviewed, if any, past risk analyses? It's important to see from year to year or time period to time period, depending on how long between risk analysis your organization performs them, what's changing, what controls are in place, what risks have changed, what business products have changed, what business processes have changed. And so if you don't have anyone at your organization that has the experience at the moment to perform a risk analysis, then you have a couple of different options. The first is to bring that individual or those individuals up to speed, get them some training, get them some resources, which we'll share at the end of this presentation, and get them to a level familiar enough with the process and the end goal to perform a satisfactory risk analysis. Another option is to get an outside source, and that comes in a variety of different fashions. Our firm, as we mentioned, provides these kinds of services. There are software tools that we'll talk about that are both free and paid for, private sector and public sector, that you can use to whatever level of assurance they provide from different perspectives to complete a risk analysis. So you may, at the end of the day, say, we're looking around our organization and we don't feel we have anyone that's capable of performing this requirement, and we don't believe that we can bring people up to speed in enough time to perform it within what we believe is a reasonable time frame, so we're going to go look outside. Or we've got someone who has experience, and we're just going to make sure that they're supported by leadership and they have the necessary background information in order to go forward. So starting with our goals, understanding what the end result is going to be, and then making sure our resources are there, whether internal or external. That brings us to one of the two biggest portions of our presentation today, and that is the scope of a risk analysis. Here you see a quote from the OCR director, Jocelyn Samuels. She said, "All too often we see covered entities with a limited risk analysis that focuses on a specific system, such as the electronic medical record, or that fails to provide appropriate oversight and accountability for all parts of the enterprise. An effective risk analysis is one that is comprehensive in scope and is conducted across the organization to sufficiently address the risks and vulnerabilities to patient data." So I thought that that quote might bring some, additional credibility to this idea that scope as a part of the preparation stage is so important. And the risk analysis process under the security rule applies to all electronic PHI created, received, maintained, or transmitted. And just as a side note, this excludes faxes and voice transmissions via telephone. So you don't have to include fax receipts or transmissions or phone call where PHI is discussed over the phone within the scope of this kind of risk analysis, just for the purposes of the rule. If that's something from an organizational perspective that you decide to include, I think there's value there, depending on how much you use, if at all, faxes. But just under the rule, it's not a requirement. So the goal, in order to understand what Director Samuels is saying, is to think in terms of ePHI processing rather than in terms of systems. Think, where does ePHI enter and leave your entity? You know, I spoke with a colleague before this presentation and asked her for some assistance based on her vast experience and expertise in a risk analysis. And I said, you know, what are you seeing in the industry when you perform these, when you review these? Tell me what your perspective is. And she said the biggest thing that she sees is exactly what Director Samuel sees, which is she sees organizations focusing on a limited system instead of the ePHI within the system. So let's talk about this for a second before we show you a visual demonstration of one way to do this. So if a challenge is focusing on systems instead of data, we need to talk about the specific places where our organizations touch or receive or transmit or access ePHI. So if you're a business associate, then think about where are all the points at which you receive or access ePHI from covered entities. Does that include online portals or file transfers or emails or paper records that are converted to digital records via data entry or scanning? You know, where do you get that kind of information, that ePHI? And if you're a covered entity, where are all the points, in addition to receiving ePHI and transmitting ePHI, you're going to be thinking about where all the points that ePHI is created. So we're talking about networked medical devices and patient portals, for example, where they input data themselves or intake locations. So, and then you can think about where does ePHI leave your organization? So vendors and online portals and emails and secure transmissions. The best way to do this, the best way to set your scope up in terms of ePHI processing and not just limiting yourself to systems is to create an ePHI workflow. If you don't have one now, then I recommend using the scoping process to create a diagram of the ePHI input, storage, and output for future reference, both for your risk analysis process, but for all of your other HIPAA and business processes as well. And I want to show you an example now of a very basic ePHI workflow. So this has, you know, covered entities and business associates, and you have the patient, and so you have different touch points to where the data is coming in, is being transferred, and is going out. And you have covered entities, and you have third-party payers, and you've got coding and billing and EOBs, and you've got the providers themselves, and you have the intake that we talked about just a moment ago. So this, as I said, is a very, very basic ePHI workflow, but I thought for those of you like me who are visual learners, you might want to see something with your eyes and say, what are we talking about? So creating a diagram for your organization, specific to your organization, that is the answer to the question, where do we get ePHI? Where do we store ePHI? Where do we send ePHI? Where do we create ePHI? And if after you've asked that question until your entire process has been completely covered, and then you create a visual representation of that, and you will have a huge resource for your risk analysis scoping process. So, one of the issues that I want to address is that if you don't use an ePHI workflow, you can still complete a risk analysis. But one warning to you is that one of the issues that tends to come up if you complete a risk analysis without an ePHI workflow is that organizations tend to rank risk and then implement controls in terms of systems rather than flow. And what happens is there may be a gap between systems that isn't considered in terms of the risk analysis and isn't addressed in terms of corrective actions as discussed by leadership. So this isn't a requirement under the security rule. It's just a helpful tool that can help us steer away from the mistake that Director Samuel has talked about in terms of thinking systems specifically. So now that we've seen what an ePHI workflow looks like, it might be helpful to talk about a specific example of a situation where an organization wasn't thinking about the scope of their risk analysis and where their ePHI was coming in and going out, at least properly. This is the Oregon Health and Science University enforcement action. You can read about it, both the press release and the resolution agreement. And this situation involved some stolen laptops and thumb drives and improper disclosures to a business associate. And the OCR issued a fine of $2.7 million. So in addition to the impetus that this is to do this risk analysis because it's a requirement on a security rule, you can find numerous organizations that have been fined. Maybe one of the most common sources of fines is a failure to do a risk analysis. So in this case, you had the university failing to conduct a risk analysis, and that was kind of the top of where the compliance investigation ended. But the problems arose because the university failed to execute a business associate agreement before it shared the ePHI of just over 3,000 patients with a cloud provider. So they didn't execute a BA agreement, and they shared that ePHI with a cloud provider anyways. And then for the stolen laptops and the thumb drives, they didn't encrypt those devices or use some sort of appropriate alternative control to prevent access to ePHI on those devices. So the issue started with multiple breaches, and the OCR investigating the relationship and the interaction with the cloud provider and the stolen laptops and the stolen thumb drives. But then as we'll see for the other two case studies, and then almost every other sanction activity that involved a risk analysis, it worked its way up from the breaches and these individual activities to the realization that the organization has failed to conduct at least a complete risk analysis. In this case, the university had conducted not just one risk analysis, but multiple risk analyses. But the OCR said that those analyses weren't complete because they didn't cover all of the ePHI in the university system. I wish that I had some more information about this enforcement activity to provide you with some details about what they missed so that we can learn from their mistakes. There just isn't, at least from what I've found, enough information to tell you what exactly the OCR meant when they said they didn't cover all ePHI. But that just lets you know how important scoping is. So a couple of takeaways, like I said, in addition to the fact that scoping is important for a risk analysis and doing a complete one, a BA agreement and all BA agreements are actually part of the risk analysis consideration. So when we talk about controls, not only is it a requirement under the rules, but it is actually a consideration, not just the existence of an executed business associate agreement, but having an agreement that provides satisfactory assurances that the business associate is going to safeguard ePHI. And then the risk analysis should also take into consideration what those assurances are. And we'll talk about that in our second presentation. But at this stage, you're just documenting all of your business associates that are subject to your risk analysis. And you're going to document any of the safeguards that they assert are in place to safeguard ePHI. So that's the kind of lesson we can take from this particular case study is we're going to look within our scope, we're going to include our business associates, and we're going to include the safeguards that they assert are in place. And then another takeaway is that a risk analysis that is incomplete may not mitigate regulatory sanctions. So the OCR wasn't swayed by the fact that the university had done something that looked like a risk analysis in the past because it was incomplete. And just if you're looking for other cases just like this one, the Advocate Health case was a situation that was similar, also fined for failing to conduct a risk analysis like the Oregon Health and Science University. So as we wrap up the concept of scope and move to information gathering, I just want to explain that this is one of the reasons that we think spending an entire presentation on planning a risk analysis is so important, is because scope determines what you evaluate, what you implement controls for, what the OCR will look at during a complaint or a breach or an audit. And just as important as properly identifying threats and vulnerabilities and impacts and likelihoods and controls is making sure that everything that should have been evaluated was included within the risk analysis. So you might be asking yourself, okay, I'm with you on this, Mark. I want to have a proper scope. Nobody's going to I'm not going to intentionally leave things out. How do I ensure that I have everything within our scope? What are the things that I can do to increase the likelihood that my scope is complete and so I don't have a situation like Oregon Health and Science University? So that moves us to our next section of the presentation, and that's the information gathering section. So once you've identified to the best of your ability the scope of your risk analysis, don't make that hard and fast. Move to the next stage and see if your scope needs to change. So here's some places that you can look for ePHI in both creating your flow and also creating your scope. So look at past and present ePHI projects, look at information security incidents, perform interviews with key staff, review your policy and procedure documentation, observe settings within your environment, look at OCR enforcement actions like we just talked about, look at audit logs for your own organization and even potentially for your business associates. And those are just a few places that you can look both to identify where your ePHI is and then to consider what the scope of your review should include. And as you look through all these places that you believe you may have ePHI, the thing you need to do next is then create inventories of assets. For example, physical assets like data applications and devices, which would include workstations and laptops and mobile phones and printers, and if you're a covered entity, certain medical equipment would also be included within that. Also, removable media such as CDs, DVDs, and USB drives, hardware, servers and hard drives, softwares, process software, security software, and then also processes. So I want to look at another case study here really quickly before we talk about some of the other parts of the information gathering stage to give you an example to look to. This is a case from the University of Mississippi Medical Center, so it's just kind of a coincidence that all three of our case studies will be university medical groups. In this case, you had a lost laptop, it potentially stolen. The end result wasn't ever determined whether it was lost or stolen. That led to the breach of information of 10,000 patients. So the laptop in this case was assigned to an adult hospital unit instead of being assigned to a particular individual within that unit or within the medical center organization. And it was used by multiple staff members, and they used it to, among other things, access a database that contained patient records. So even though an individual staff member's password was required to access the network on the laptop, the database didn't require an individual login. So if you were able to access the laptop, if someone signed in their password for you, or the password was signed in and they walked away from the laptop, you could access the database without any kind of additional control restricting access, so password or other token. As a result, the OCR issued a $2.75 million fine. And the findings were, again, a failure to conduct a risk analysis, but what it started with was a failure to implement safeguards for workstations, a failure to assign unique user IDs, and this had gone on for approximately a decade, the failure to assign unique user IDs, and a failure to perform proper breach notification. So as we talked about before, what happens here is we're seeing kind of the reverse of the process that we're trying to encourage in this presentation series, and that is not waiting till a breach occurs, but using these risk analyses to find out the kinds of things that the University of Mississippi may have found out if they had conducted a risk analysis. They may have realized that for almost 10 years, they weren't assigning unique user IDs because they would be looking at their process for bringing on new employees and granting logical access. And if they had a policy that said everybody has to get a unique user ID and that they did monitoring and auditing of that process, they may have discovered, hey, either we don't have a policy or we have a policy, but it's not in place. And then they would have been able to use that information in their risk analysis, both in the analysis phase and then also the use phase, where they decided what to do with it. Any kind of controls to remedy the issues that they had. So what started with a breach ended up in a discovery that, sure enough, our risk analysis hadn't been completed. So a takeaway from this case study is to show how important it is to include our processes within the information gathering and scope phase of scope considerations of our preparation, looking at things like login monitoring and data backup and change management and transmission security, breach notification, password management, workforce termination, and then just generally looking at your policies and procedure governance to include all these processes. So if you're looking for a single place, Mark, where do I go to figure out what my processes are besides just observing over and over and over again? Go to your policy and procedure bank and look there. I wouldn't stop there. I would, as I mentioned before, conduct interviews and observe processes, but your policy and procedure library should provide you with the kinds of processes that should be included in a risk analysis, especially in things like workforce termination. So we may think, well, risk analysis is talking about ePHI and how I secure ePHI, and so I'm going to go to things like networks and workstations, but terminating an employee may have nothing to do with that employee's inappropriate access or disclosure of ePHI. But a failure to include that in the risk analysis makes it not in compliance with the security rule requirement. It makes it insufficient for your organization's compliance, security compliance needs. So that's why it's so important to look at your policy and procedure bank, because it will bring to your attention potential processes that may have escaped notice otherwise that actually impact ePHI. So in addition to processes, we also want to think about locations. So are there additional offices or facilities or a co-location or a data center that receive, transmit, create, or store ePHI? And then vendors. So we're talking about software vendors and infrastructure and support and administrative. Going through the list of them, obviously including all of your business associates, but even organizations that might not be a business associate or a vendor of a BA that might not seem obvious, that don't have a BA agreement, that may have access to ePHI and then may be subject to the risk analysis. And then lastly, within the information gathering stage, I already talked about this a little bit, but is considering your human resources. So what individuals and departments are responsible for each of the processes that we talked about, like login monitoring and data backup and change management. One of the easiest ways to identify that is to go to your organizational chart and look at executive management, look at your chief information officer, your chief information security officer, your information system security officer, privacy officer, data owners, data custodians, auditors, business continuity planners, security administrators, systems administrators, even your physical security. So thinking through all of your the individuals in terms of the roles that they play and the way that would impact threats and vulnerabilities to your ePHI. And not only identifying those people, but then also thinking about the processes that involve those people. And we're going to talk about a specific case study here involving training that highlights a part of the kinds of things that a risk analysis should involve. And this involves the University of Washington Medical Center. They had a breach in 2013 of approximately 90,000 individuals' records. And what happened in this case was an employee received an email attachment with malware They opened the attachment and it infected the employee's entire computer. And the University of Washington was levied a $750,000 fine. But beyond this, I just thought this note was interesting. I read that there was an estimation that it would cost the university approximately $180 per patient in remediation efforts, so root cause analysis, adjustments to policies and procedures, and administrative costs for dealing with the breach. And that's, doing quick math, that's a total of $16 million. So the fine is one thing, but the remediation costs are significant, and I can assure you that the cost to do a risk analysis shouldn't result in a $16 million tab. So here we have just a cost-benefit analysis from just a pure financial perspective on what the University of Washington had to spend. If you think about it that way, that's what they ended up spending for their risk analysis was almost $17 million. In this case, the university actually had a policy requiring its affiliates, that's where the breach occurred, its affiliates in its system to conduct a risk analysis, but the affiliates weren't complying with the policy requirement, and the university wasn't monitoring or enforcing the compliance efforts. So if they had been if the university had included within its risk analysis its affiliates and then enforcing its own policy, you might have resulted in an awareness of employee training and perhaps other systems related to email software that might have aided this affiliate in detecting the malware on the attachment, and including that as not only a potential threat, but then also discussing whether or not the controls that were currently in place were sufficient to prevent this kind of action. And then maybe this employee would have had proper training and would never have opened it, or it would have denied. This issue would have been identified from a technological standpoint before the employee even had a chance to do it. So we're talking about information gathering. Again, we're talking about not just the data locations where ePHI lives, but also we're including people and the kind of training that they need. And aside, another takeaway from this case study is that it's not just business associates and vendors who need to be considered in the scope and information gathering stages of a risk analysis. It's also affiliates and wholly owned subsidiaries and parent corporations. So as you're going through the process of deciding and determining the scope of your risk analysis, you need to understand your organization structure. Are there other parts of your organization that are legally distinguished, but yet connected in a way that the risk analysis should include them entirely, or should include parts of their activities, and then that entity should perform their own risk analysis? I think in the case of the University of Washington, they should have included those affiliates as part of their own risk analysis, but then per policy, those affiliates should have conducted their own separate risk analysis under the security rule. So that's just a quick aside that it's important to think of vendors and business associates when we're talking about a risk analysis, but it's also important to think about the way that your organization is structured. Are there other parts of the business that on their own wouldn't perform a risk analysis, and then do you include them wholly in your scope, or do you create policies for them to conduct their own risk analysis, or what's the way to ensure that that part of your organization is covered? So this is something that may seem obvious, but it's important to state as we're talking about the information gathering stage. The OCR has issued guidance where they said that documentation of the information gathering stage is a requirement. As I said, it's probably obvious, but as you're going through identifying your scope and identifying your human resources and your assets and your processes, that you want to be documenting this, creating assets lists and process lists and vendor lists and people lists and processes lists that could be used to support your compliance efforts when it comes to an inquiry about your risk analysis process. So that'd be the kind of documentation that would be useful if someone said, what What was the reason that you concluded that these were all the things that were within, that should be contained within your risk analysis? And so if you have an asset list that gets down to the level of workstations and laptops, both owned by organization or owned by the personnel, but still have access to ePHI, then you can say, well, here's the reasoning that we use to get to this result, and you're much more likely to come out successful. So we've talked about the goal of a risk analysis. We've talked about the resources necessary to conduct a risk analysis. And then we spent most of our time talking about scope and information gathering, the importance of casting our nets over all the appropriate areas before we begin the process, or before we complete the process. Certainly, there are ways to conduct a risk analysis in stages, certainly, but before we complete the process, for sure, to ensure that we've got all the required parts of our organization, not limiting it to just medical records or other systems that may be obvious, but really thinking through the way ePHI comes into, stays, and then leaves our organization. And then we went through some of the ways to identify how ePHI comes in and what the scope is, thinking about all of the different places that it might reside, it might be connected, it might be impacted by. So our last item for this presentation today, before we get to our conclusion in our questions section, is just thinking about perspectives. How do we ensure that we've accurately captured all of the information we need to properly complete a risk analysis? You know, if you buy into the idea that planning is important and you've done a lot, when do you know that you're ready to move forward and to actually execute and talk about threats and vulnerabilities? And there's two ways to do this, just like from the very beginning. So internal resources. This might be an appropriate time to bring in individuals who aren't leading the project and to present with them senior management or others with technical or compliance expertise to say, here's where we think our risk analysis should cover. What do you think? Are we missing anything? Here's our supporting documentation. Are we ready to go, or are there some specific areas where we need to continue researching? And then the second is external resources. We'll talk about those in just a minute, but beyond just private entities that could provide you with assistance or software tools, finding out a third party that has expertise, who has experience, who can help you determine whether or not your scoping and information gathering is complete. So that brings us to the conclusion of our presentation today. So just kind of as a quick wrap up, our goal in a risk analysis is to measure risk instead of identifying whether or not we have strict compliance. And you know, I've got my cliched preparation phrase for those of you who are worried I wouldn't give you one. From Benjamin Franklin, he said, an ounce of prevention is worth a pound of cure. And in this case, prevention is really a substitute for the concept of preparation. It's so much better to begin a risk analysis having thoroughly prepared than try to go backwards afterwards and uncover all the areas that you might have missed. And just from a practical perspective, but also a regulatory perspective. That preparation involves the right resources for the project, it involves the proper scope, and it involves all the necessary information to complete the risk analysis. And finally, we're just here to save you money. You think about it this way, the University of Washington paid something like, after you calculate their fines and their remediation costs, something like $16 million, and they were required as part of their resolution agreement with the OCR to perform a risk analysis within something like 60 to 90 days, which could feel like a really tight turnaround time when you have a government entity breathing down your neck. And so our goal here is to help you save $16 million. Consider this webinar series a coupon for $16 million and a way to complete this process before the OCR gets to you. So, you know, you can think about it there's two ways to do a risk analysis. You do it yourself in advance of any issue, or the other way is to have a breach or a complaint and then have the OCR investigate, and they require you to do it, and you're forced to pay them for the privilege of doing it. So we'd like to think of this as a little gift to you to help you complete your risk analysis, and not just, as we talked about at the beginning, not just to satisfy a particular regulatory requirement, but to set you out on a foundation to uncover potential issues that you either weren't aware of or you're aware of, but after consideration you determine that the controls in place to address those risks are not sufficient. So as I mentioned at the beginning, our next webinar will be conducting the risk analysis, and we look forward to sharing that with you. There are a couple of resources that I wanted to point out to you that are just too lengthy and to include in this particular webinar. We'll talk about them to some degree specifically in our next presentation, but there are three. The first is the Security Series paper. It's number 6. This is guidance from the OCR on conducting a risk analysis. It's not very long. It's not overly detailed, but it's something you can look at. On the other hand, you have the NIST 800 series, both 53 and 53A. This is a risk analysis approach. This is not HIPAA specific, but HIPAA does not specify the type of approach you use for conducting a risk analysis. So if you're looking for some very thoroughly, heavily detailed information on how to conduct a risk analysis, this will be the kind of information we talk a lot more about the concepts in our next presentation. This is some helpful guidance for you. And then finally, the ONC Security Risk Assessment Tool, and this comes in a couple of different flavors. You have an online tool that walks you through questions and answers, and while it doesn't guarantee HIPAA compliance, it is a tool that you can use in your toolbox to getting you closer to HIPAA compliance. And then there's also some useful information that we'll talk about in our next presentation in some of their guides that they use for the security risk assessment tool. You can do it in kind of a paper form, and it gives you a sense of what you should be asking and identifying when you're conducting a risk analysis. And all of those are free and easy to find. So I hope those resources are useful to you today or some other day. And at this point, I wanted to open it up. We have a few minutes if anyone has any questions.
Great. Thank you so much, Mark. Lots of really good information there. We do have a few questions. The first question is in regards to scoping. Do you have any recommendations for how to make the analysis comprehensive enough to satisfy requirements under both HIPAA and PCI? The same exercise, same evidence, slightly different standards. Is there a way to have one report for both?
I don't know that that's possible. I guess if your systems, if your payment card information enter and stay and are created and transmitted and stored in all of the very same places that your ePHI is created, transmitted, received, and stored, then you would have, you would be able to identify the controls. I know that PCI DSS, I think around 3.1 or 2 at this phase, you know, there's some specific controls in place that are required that are much more explicit than what's required under HIPAA. But the process is the very same. You're thinking about data flow and walking through your organization. You know, sometimes we do that as a company. When we do assessments for PCI, we actually walk through an organization and ask them to say, where does your where does your payment card information come into your organization? And we ask them and ask them and ask them. Sometimes we've completed the physical walkthrough, and then we check again and say, well, what about the mailroom? Does payment card information come in through the mailroom? And then sure enough, you know, you'll find a letter that includes some credit card information. So the process is the same in terms of, especially as we go through next week when we talk about identifying threats and vulnerabilities, the likelihood, impact, and controls. The process is exactly the same. But unless your organization flow is exactly the same for both types of information, then you're going to have different inventory lists, your asset lists, your people lists between the two different types of risk analysis.
Great. Thank you for that. All right. Another question. What is the biggest mistake organizations make when identifying the scope of a risk analysis?
This is just to kind of reiterate what Director Samuel said, thinking, and my colleague that I talked to, they said thinking of systems instead of data. They say, okay, we're going to look at our network, or we're going to look at our where we back up our data, or we're going to look at our patient portal, where information is input by our organization or by the patient. And that's what we're going to look at. We're going to look at the access to it, the hardware involved, the software involved, the people involved, and then they miss the vendor, or they miss another place where ePHI is created. So the biggest mistake is thinking systems instead of data.
Okay. All right, and how do we reduce the likelihood of making that same mistake?
So this goes back to ePHI data flow. So the way to prevent that or reduce the chance that you make that mistake is really to walk yourself through your organization as if you were ePHI. And then the second thing would be to look at your policies and procedures. So your policies and procedures are much more likely to be process-oriented rather than system-specific, at least that's my experience. So processes like logical access and employee termination and personal device use, those are processes rather than just systems that require approval and review and monitoring and auditing. So if you create or use your ePHI data flow, and if you look at your policies and procedures, you're much less likely to think of your scope in terms of systems instead of data.
Okay. What are some important things to think about when considering the level of evaluation for vendor risk?
So I think there are I can think of four things that would be important for, we're talking about vendors or business associates. First is the obvious one, but it may be require more evaluation than it seems on the surface. Do they have access to ePHI? So I can think about that from a software vendor or an IT vendor who's providing a service that may not directly create ePHI, or they aren't a software that's directly relates to ePHI, but do they have an ability to access that ePHI? Or if they're a information technology support organization, third party that comes in and they're working with your hardware, do they have the ability to access ePHI? So first question, obvious question is access. Then the second question is thinking about how they access ePHI. So assuming that the answer is yes for a certain set of organizations or all of your vendors or BAs, is it in your system? Do they receive it from patients? Do they receive it from you? Do they receive it from another business associate or another covered entity? Just thinking through the ways that your vendors access ePHI. And then the third issue would be, does that entity have the ability to change PHI? That takes it to a whole nother level beyond just do they have the ability to access it. It's do they have the ability to actually change that information? The level of risk, the level of controls, and the level of evaluation is much, much greater. And then the fourth thing would be, are there specific security obligations in the BA agreement that you need to include in your control consideration?
Okay. All right, we got a couple more questions. Let's see. What are some areas that organizations might inadvertently overlook in scope and information gathering?
So a couple of different areas. Data backup. So that, for example, I can be transparent on this one. That ePHI workflow that I included in this presentation, if you review it, it doesn't explicitly have data backup. I know it was intended to be illustrative rather than complete, but it didn't include data backup as part of the ePHI data flow. So that's something that should be included in the ePHI data flow, but it's a proactive control rather than a service, I guess, unless you are a data storage provider than it would be your service. But data backup is an area that organizations might inadvertently overlook because they might think, you know, it's not necessarily even leaving the organization in some cases. And then the other one that's probably even more likely to be overlooked is disaster recovery, because that is a lot easier to overlook on an ePHI data flow. So the questions you should be asking or issues you should be thinking of are, do we have a process or procedure to restore data loss? Do we have a list of critical hardware, software, workforce members? And then has a disaster recovery plan been tested annually? So that's certainly an area, especially if your geographic location places you in a place where there's hurricanes or floods or some other physical environmental circumstance that's more likely to impact you depending on your geographic location. So data backup and disaster recovery would be two areas that might get unintentionally overlooked in scoping and information gathering.
All right. Okay, we've got one final question. Are there scoping risks that can come from being too inclusive in your assessment?
They're risks only in the sense that you'll now be aware of them and you'll be responsible to address them. And then consequently, the OCR would be aware of them and would want to know how you address them. But from a compliance perspective, there's no downside. There is a sense in which you could have scope creep to the point that you are preparing for a risk analysis for 6 or 7 or 8 months, and it never actually gets done because it just gets fatigue and you just keep looking and looking and looking. So there is certainly a point at which you have to cut it off. My experience has been that that's not the problem that most organizations have. Most of the time it's an insufficient scope rather than overly broad.
Okay, thank you. All right, well, that is all the time that we have for today. So thank you again, Mark, for preparing this information for us. Thank you, everyone, for attending, and be on the lookout for an email from us with copies of the slide deck and a link to the presentation, as well as invitations for the next webinar, which will be conducting the risk analysis on Tuesday, February 28th at 1 p.m.